Hi, my name is Andrew Phillips. I'm the founder and the editor-in-chief of ABEM Coach. I wear a few other hats you can see on the slide, but for right now, I get to wear the hat of teacher. We get to talk today about one of my favorite topics. It's not one of the topics you'll see in the 20 chapters in ABEM Coach. This is, in one sense, the softer side of preparation for the test. On the other hand, a really crucial component to get you the score that you need. This is about how you test. I still don't have any disclosures, and here's what we're going to go through. So what is your best approach for studying? What is the best approach for the individual questions? And then explain how to best approach the exam as a whole. So the reason we're talking about this is that I love this quote. It plainly says and puts it out there. We're not actually very good at assessing how much we learned. And I know it feels like you can say, well, I learned this way, or I learned that way, and I learned a lot in this circumstance, and it just doesn't hold true. Multiple times over, there have been studies showing that if you ask people how much they think they learned, they either way overestimate or way underestimate. Actually, that in and of itself is a whole other talk, but I want to bring this up front so that go ahead and for just a little while, please try to set aside those prior thoughts you've had, what works for you, what doesn't work for you, and let me introduce some evidence and see if I can convince you to tailor your studying in this direction. If you're watching this, it probably means you're looking for a little extra help, and I encourage you to make that shift. So up front, here's what we're going to end up suggesting. For your studying, do item recall. Essentially, that's doing practice questions. Do spaced repetition, and that is a specific sequence of looking at something, giving it a little time, looking back at it, giving it more time, looking back at it, and then you see where this is going. You're going to do that for all the different topics, all the different chapters, all the different pieces that you need to learn. Space it out a little bit in a very specific way. We're going to talk about doing blended learning. Make that a part of your learning process as well. So you're not just doing questions, you're also reading out of a book, you're doing some lectures, maybe listening to our lectures in podcast format. You're going to mix up the things that you're doing to study. Do not task switch. Get into an environment where you can focus on your studying. Notice I didn't say multitasking there. That's another conversation too. We're going to encourage you to, when you approach the questions, identify the learning point and the specific question they're getting at. This is not clinical medicine. This is test medicine. There is a difference. Identify the similarities between the options. Use that to your advantage. Do not read into the prompt. If it ain't on the page, it ain't important. Done. For the exam, we'll go over a few of the fundamentals for you, but also focus on using the flags and don't perseverate on a question.